Very good morning. At the outset, I would like to thank Dr. Amulya Sahu and Dr. Jagannath Boramani sir for giving me this opportunity. So at the end of a cataract surgery, we all expect to give the patient emmetropia, and that's what the patient also wants. So what factors will affect astigmatism and how to overcome these factors is what I'm going to discuss about. Things that we have to look at is pre-existing astigmatism, then when giving cautery, what points to be noted, incision character, and also the suture characteristic. So pre-existing astigmatism, obviously a good A scan is going to help us, and always go through the A scan. One is to see for the IOL power and also to see where the steeper meridian is. So placing your incision at the steeper meridian will definitely flatten the meridian and also will give you better results post-operatively. And so when giving cautery, when you always cauterize using a wet field cautery and only cauterize the bleeders, do not go in a random fashion. I would suggest cauterize only the bleeders and never go into the blue zone or the limbal area. So if you're going to cauterize in the limbal area, again that's going to induce astigmatism, and always make sure the tenons is well separated before you cauterize, because that will cause charring, and again you will not have a clean wound. So cautery is again very important. Excessive cautery will again cause scleral shrinkage, which can also induce astigmatism. And so next, incision characteristics. I'm happy that Dr. Deva Prasad has already mentioned so many of it. So as we all know, the location of the incision, the size, the shape, and how you configure the wound is very important. And location, as I already mentioned, it is better to place your incision in the steepest meridian. However, a temporal incision is supposed to be much effective in controlling astigmatism. The other thing being, as the age patients have against the role astigmatism. So when you're going to have a temporal incision, it neutralizes your astigmatism. And size of the incision largely depends on the size of the nucleus, the type of cataract you're dealing with. The shape, again, each one is used to a type of incision, but it's always good to switch over to the best type, which I will be describing soon. So location of the wound, again, don't go too close to the limbus. Always stay 2 to 3 millimeters behind the limbal zone. So the farther the incision is from the limbal zone, the astigmatism is going to be less. And so again, when it comes to the wound, you have something called the external configuration and the internal configuration. So as we all know, people, we all use these kind of incisions, that is the smile, straight, frown, or the chevron incision. So why these incisions are good, I'll tell you which among these is good. So that is the external configuration. Internal configuration, again, we prefer a triplanar incision. That is, once you create the wound, you enter, and then you dip your the internal entry, and then you make it. So what happens is you have a 3-planar incision, and wound sealing is better. You won't have wound leak. So the type of incision, there's something, as he already mentioned, there's something called the Cott's the postulate. He postulated that there is an imaginary tunnel that spreads outward from the limbal area. So you can see this here. So as it goes out, if your incision is going to fall within the tunnel, then you're going to have lesser astigmatism. So if you see the first, do you have a pointer? Okay. So if the first, so the first incision, the straight incision, this is too small for any nucleus to come out. So, it's going to be definitely large, and it is going to fall outside the imaginary tunnel. So whereas the frown is also the similar way. Yeah, thank you. So this frown or the chevron incision is actually within the imaginary tunnel. And the other thing is there's something called the chord length and the arc length. So the chord length is from the point of initiation to where you end your incision, whereas the arc length is the distance. So this will be your chord length. So this is your chord length, and whereas this will be your arc length. So the chord length, the more the chord length, the better will be your astigmatism control. So again, the length of the wound, the more your length of the wound, then you're going to have more astigmatism. So these are the points that we'll have to remember. That is the length of the wound. So a chevron or frown incision, what happens is the chord length is more. So the length, this way is going to be more. So your astigmatism is again going to be less. And external configuration, internal configuration also has to be kept in mind. Last thing is the suture characteristics. We need to apply sutures at time, and don't shy away from applying sutures, because good wound integrity is important, especially in case of SICS where you're going to have a large wound. If you don't have a proper wound, you can end up with endophthalmitis, and you can end up with a soft globe and all that. So it's always important to have good sutures. And again, the length of the suture, where you place the suture, your suture material, all that is going to be useful. So if the length of the suture and the distance between the sutures, if you have to apply 2 or 3 sutures, if your tunnel is not good, you have to apply 2 or 3 sutures, then if your length of the suture is equal to the distance between each suture, then you are going to have no astigmatism at all. Whereas if your length of the suture is more than the width of the sutures, the distance between each suture, then you're going to have with the rule astigmatism. And when it is less than, the distance between the sutures and the length is going to be shorter, then you're going to have against the rule astigmatism. So tight sutures, again, you will have with the rule astigmatism. Loose sutures is not going to be of any use, because it's not going to approximate your wound. So this is what will happen. If you're going to have a tight suture here, then that place will be depressed, and then that area will be having some amount of astigmatism. So again, the superficial sutures will cut through the tissue, and again, it's not going to be useful. And using tenno nylon sutures, non-absorbable sutures is more helpful, because when you use absorbable suture, it's going to degrade, and again, it is not going to be effective. It takes about 3 weeks at least for your wound to approximate and to give you the best outcomes. So the suture has to last that long. So again, suture orientation is, it has to be radial sutures. You cannot have non-radial sutures. It has to be radial sutures. So what you have to keep in mind is the pre-existing astigmatism, and calculate your wound even before you start doing the case, where to place your wound and how to place it. Cautery, again, give a lot of importance to cautery. Again, wound and the suture characteristics. Thank you.